I'm Dr. Ann Ingraham. I am the Chief of Staff for the GVA, and I also have my own company co-founded with a very good friend of mine. And we have a product in the market called Axion Galaxy 360. It is a case management software built on a blockchain. The blockchain infrastructure is provided by Burst IQ. They're not here representing today, but they are GBA members also. And they've been very, very, very good supporters and partners of us as a startup company. I will tell you that a lot of times when we're in this type of meeting, we're more focused on the technology. But really the technology is of no good, really, unless it's having a positive impact on people. And so that's the reason why we started our company. Our first use case kind of brings me to tears when I think about it. We launched our software in the Tacoma, Washington market in 2022. It's currently being used by community-based organizations who provide services to individuals coming out of incarceration back into the community and to vulnerable populations, right? So the technology, whatever it is you're building, make sure that it's having a positive impact on a person. And in health and human services, I'll add the health and human services part to it. That is where we focus. Our goal and our mission for our company is really to provide a solution that would help to bridge the gap for the non-clinical considerations that makes up an individual whole person. A lot of times, for example, the health systems provide the technology to support providers from the clinical standpoint, but there's a significant gap when it comes to those factors which are the social determinants of health, like housing, transportation, employment, all of that. And so our organization and the community-based organizations who are using our solution, it's helping to do that, to bridge that gap for the people, the client base on our Genesis use case, who they're providing services for. Now, I'll give you a little bit about our roadmap because, again, we're just starting. We're in the market, trying to get a head start here. As you know, one of the biggest challenges that we all face is adoption, right? There are significant barriers for that. And that's one thing we do have to break down with education as well as mentoring those who are decision makers in organizations who may have that old guard mindset, let me put it that way, especially in government organizations. So those of us who are sitting here who are innovators, we need your help to get past those barriers, to be able to bring this technology to the government entities so that the services can be provided to those who are underserved and to bridge that gap in equity and health. I'm a veteran, right? Veterans out in the community need services and we need technology to help bridge that gap. So again, our first use case was working with those individuals coming out of incarceration. And one of the things that we're working on right now, we've got a little bit of funding from one of our CBOs, community-based organizations, to develop a digital wallet to help support those individuals who may have housing insecurity and who lose their documentation a lot, to put their documentation digitally because they have a smartphone, right? They may lose everything, but usually unless it's stolen, they have their smartphone with them. It's so critical, their licensing, their educational documents, those types of things. If they lose it, it sets them back, okay? So that's one. So the digital wallet, yes, we don't need blockchain for that, but there is a future vision for that. Also, if we can also employ tokenization to helping those individuals, not only for incentivizing them for better health, okay, as well as programming, But also, if we're able to tokenize it and also reward with an economy, an individual coming out of incarceration who may have other significant barriers, we may open up an economy for them. So again, that's a little bit way down the line, but that's the vision that we have, to really empower, to start to empower that individual again, give them back their power that they've lost for whatever reason, okay? And support the caseworkers and navigators to help with that. That's a Genesis use case. The next use case that we're starting to work on is to be able to support health systems like the Kaisers, like the Sutter Health. When they're doing discharges, when they discharge an individual back into the community to help to bridge that gap again for those service providers, to bring them onto the network and help with that closed loop referral process. And in that, again, tokenize it for wellness, right? If you have a chronic disease like diabetes, which is prominent in the African American community, how do you tokenize someone like myself to eat better? Is there an opportunity for that, right? Rewards could be tokenized and supported. So I say that to say, we've started a journey. We recognize that there is a significant gap digitally to support individuals who are underrepresented a lot in the community. Agreed, it's not a sexy place to be. It's not a unicorn project, but it has a human factor to it that we must consider. Otherwise, the technologies have no use, okay? And I say that because I'm an ordained minister, and so, I'm not a pastor. I don't have a pastor's heart. I tell people that. But I still see the human suffering, and I see the need. One of the things I'm also working on, aside from the health and human services aspect of it, and I don't know if we've ever thought about it, but this is churning inside of me right now as I'm being exposed more and more and more, is to bring the Web3 technology to the Christian community. How do you deploy technology to support churches, right? Usually we're the last to get on board. So I think there's some opportunities here from a regular 9-to-5 job to the theological side of the house, because again, part of the social determinants of health of an individual is their faith. And so we do have to bring the faith community into that also. So I don't know how much time I have left. I guess I could talk some more, but I've got 5 minutes left, see? Okay, any questions? All right, no questions? Let me point out that, I'm going to emphasize one of the biggest challenges that we face as innovators is adoption of the technology. And so I think there really need to be a push for that, greater than what we're doing here, sitting on this ground here. We need to push the message out. We need government to really step it up, right? Because again, we're going to be, there are some people who are going to be left behind because of their lack of digital literacy. So there need to be programs that are going to help to bring digital literacy up to the level that we are at right now sitting in this room. There also needs to be help with pushing it into, like I said, the leadership and decision makers, right, who need to make the decisions and get away from the fear of early adoption of this technology, okay? So any government leaders here, I know I see you. Remind me of your name again? Catherine. Catherine, I'm going to charge you, and I know you are a proponent of this, but if you have to stomp your feet harder and bring a force multiplier like this community here behind you, right? Reach out to us. We can help to educate those who are resistant to change. The technologies that are represented in this room and downstairs will not go forward unless we have adoption. And if it does not go forward, it cannot impact the people who are dependent on it. Right? That's my passion right there, I will tell you. We sit in these rooms. Yes, Catherine, go ahead.
to what's people on that. And you know something very fortunate that there are literally plenty of people who may grasp like that every time an end is just clear, or if they are saying not whatever they start passing a lot of times it's dusting is just clear. And it has their ability to access their ability of security and stuff, services. And so again, an organization wanted to partner with you. Well, what that looks like for a nonprofit to work with you when they already have the cases that you're working. Therefore, dealing with it every day. And a new board. So that we are very yes, here that.
Okay, excellent, excellent. I'm glad you asked that question. First of all, contact me. That's number one. Okay. Number two, we would work with the organization, whoever the navigators or caseworkers are, to onboard those people, the client base, right? Onboarding, 1 minute left. Onboarding means that we'll get their documentation, have them loaded in, whether it be scanned or loaded in or digitally processed. We store it for them. We'd give them an app on their phone that they would have access to their documentation. And of course, we're using blockchain, we're using the smart contracts and all of that to help to manage granularly who can have access to their documentation also. But I think the first part is meeting with the organization, develop a strategy, right? Develop a way to support and manage those individuals, especially if they're digitally challenged. How do you provide that human support for them also? And then onboarding their documentation and help them to understand how to use it. So that's first start. Yes.
Right. I think on by the U.S. But this is something that requires to our state to
Yes.
people that have to do but no, they can't actually do that. They are not. That is not.
Yes, I so agree with you. And that's why I don't remember who was sitting here, the lawyer. She talks about the molasses pace of the legal system. Michelle, again, that's nothing new, right? It is what it is. The legal system lags the technology and it's done it for decades, right? But recognizing the arc that technology is in right now, the legal system has to catch up to it, right? Regardless of your politics. Otherwise, you're going to continue to have a population that's left behind, right? And that we talk about digital equity, health equity and inclusion. You cannot have that without leveling that playing field. If you need me to come talk to your state legislator, I'm there for you.
Is Pradeep here? No. So Pradeep was supposed to be our next speaker, also on healthcare. I had to step away, so I missed most of your presentation. But where do you think the future is? Come back. Will you share with us where you think we will be in 5 years?
I think with the proper support, so if you remember in 2009 with ARA and the HITECH Act, right? The government mandated the adoption of the electronic healthcare record in ambulatory systems for the healthcare market. If something like that is not done in the inpatient sector of healthcare, if something like that is not done for the community-based organizations, we will fail, right? There needs to be not only the human resource support at the community level, but also the finances needed for technology, right? So when the during the 2009 timeframe, okay, with Obamacare and ARA and HITECH, monies were provided to the inpatient and other qualified providers. They excluded some. Where the money is really needed, where the support is needed, is when that patient is out of inpatient and back into the community, right? we need funding. They need funding for the technology, to afford the technology. I'm not talking about buying Epic system at $1 billion a pop, or Cerner at maybe $500 million a pop. We're talking about nimble technology that will support not only the clinical documentation, but also the non-clinical documentation of services. In addition to that, even more so, is the analytics that needs to go with it, right? Where will we be? Without help, failure. Without adoption, failure. Without adoption and help, people continue to remain sick, both physically and mentally.
People in government do. Give us the top 3 things that a person in government could do to help.
All right, so I'm not government, so maybe what I'm going to say will make no sense. But in any organization, tough decisions need to be made, okay? And that tough decision may need to be replacing those who are being barriers to progress, okay? That's number one. Easier said than done. How do you do it? I don't know. But I think that unless decision makers get on board, unless lawmakers get on board quickly, and unless the financial services monies flow in, it will not happen, okay? And then that public-private partnership is critical, right? Bringing that ability to innovate and commercialize, coming together with the goal. In healthcare, we have what we call the quintuple aim, right? The aim of having, first of all, the patient or the client in the middle of the conversation. That's number one. But we need the population health, right, to be able to track that quality, whether it be by zones, by district, by area, but again, quality because of outcome management, okay? We need the experience to be improved, both the experience for the patient and also the provider. Cost, right, is one that is, we need value-based services, value-based cost, okay? And then last but not least, that makes 5, right? Patient, provider, experience, the quality of the population health, the cost, and the 5th is that digital equity and inclusion. Absolutely. So for lawmakers, if you take that model and you think about what it takes to make progress in those 5 areas, we will achieve what we say we want to achieve to ensure that the American population is not disparately represented in a new digital paradigm of health, equity, human service, and inclusion.